Good evening to everyone. Just a few moments before everyone gets in. So while we're waiting on everyone to get in, good evening, go ahead and place your name and campus in the chat. Read just a few more minutes. On yesterday, the same thing happened. A storm popped up. So just if we lose connectivity, just stay right there. I'll log in on a different device. So hopefully it won't be like it was yesterday. So good evening to everyone. Go ahead and place your name and campus in the chat. We still have a few more that are joining. Your name and your campus. And with your name, make sure that you're placing your name how it appears on the roster. If you're undergoing a name change and it has not officially occurred through the school, make sure that you list your name how it appears on the roster because we don't want it to be appear that you're not here when you really are. So place your name and campus in the chat. Give you a few minutes to do that. And then check your screen name and ensure that your screen name, your first and your last name is correct. Sometimes when we're on devices or we're using someone else's device, sometimes even on our own device, it'll rename itself or give the original name. So check your name on the screen and ensure that it matches how it appears on the roster. Give you about 2 minutes to get all that. So good evening for those that are coming in. I think we still have like two more that's trying to get in. If you would, go ahead and place your name and campus in the chat while we're waiting on them to get in. That's your name and your campus. Once you have your name and campus in the chat, go ahead and check your screen name. Ensure that, and when we say your name, that means your first and your last name. And then check your screen name and ensures that it is correct, your first and your last name as well. Give it a minute or so, get that done. All right. So good evening again to everyone. Welcome to Nursing Across the Lifespan. And so as you have looked in your modules, you see that this course encompasses three different courses. So every 3 weeks, you change the content. So we have mental health in this block. So, and just check your schedules and make sure that you're in the correct rotation. So this is C. This is section, let me share my screen here, section PC, P2C. If you have changed sections or switched up classes, just make sure that you're in the correct class so that you'll be given credit for where you know, for your attendance, because it's very important. So this is where we're at. This is section C. Okay, make sure you're in the correct class. Sometimes, you know, you will change classes because of days and times. And so you just want to make sure that you're sitting in the correct space for your attendance because everything matters. And I'll say that several times. Everything matters. Your attendance, your time that you're logging in, and everything. So I'm Dr. Ford, been with Ford is here for a couple of years now, teaching various courses. And so the content, if you need to a quick reference to, you know, contact me or any of your instructors, always go to the About Instructor tab that is in your modules. So I know sometimes you're like, oh, where's the Zoom link? You know, where's the phone number? You know, who's the online dean? But in your under your module section, you have a tab, and I'm scrolling here just to make sure it's there. Yes, it says about your instructor. And then you have all of us listed because there are actually three different instructors for this one course. You'll be with me for 3 weeks, and then you'll move on to the next rotation. I'm not sure if you have P's next or if you have OB next. Right, let me get our PowerPoint pulled up here. We do have the orientation PowerPoint. We won't go through each slide, but we will make the orientation PowerPoint slides available to you so that you can always refer back to them. So I like to always just remind you that these sessions are recorded and they can be viewed by the attendance administrator. So just make sure that you just keep in mind that we are being recorded. Okay, put this PowerPoint for us here. Just going to kind of go over some of our expectations, and then we're going to jump into our content. So we mix it up in this class. Are there any questions before we move forward with the orientation PowerPoint? Any questions or concerns? So before, and you can come off mute or you can put them in the chat. Now I'll periodically look in the chat as well. Before, let's see, when did we start 2.0? We've been doing not all of our classes are 2.0, which this is the new version of it. Because before 2.0, these classes were, by themselves. They kind of held their own. And so with the revision, this is how you have the rotation. This is an accelerated course, so things do go kind of fast, and so just make sure as we're looking and going over things that you're not getting overwhelmed. You identify, what you need to do differently, what you need to add, delete, and put on pause, as I say, because this doesn't last forever. You're almost there because this is when you're in mental health, you're almost next to your last term, I believe. I'm looking at your journey as I recall the journey. So you're almost there. So just hold on. Bring forward, with you those things that have worked well for you in the past, those things that have not worked out well for you. For example, if you thought just reviewing things at the last minute worked, your results didn't show that was a good idea. Let's delete that. Let's bring forth those things, and hopefully we can add to that as we move forward. So I like to always go over like some test taking things. So we'll add all that in there. But we're here for a good little time tonight, and so let me share my screen with the PowerPoint here. And I'm not going to go over all these slides. You are the adult learner. You're here because you have chosen to be here, and so just keep that in mind. And we are, even though we're not in the same physical space, we do expect the expectations are the same. Is that we still be respected to one another, and that the environment remains conducive for actually learning. Let's see here. Let's say we're not going to go over all these slides, but they did add in a few new things for us here this term. So of course, I am always the first line of contact. Let me make sure we're still recording. Yes. And so that goes for all of your courses. So in the event that you think you might need to, yes, I had stopped sharing for a moment to make sure I was recording. So for any of your courses, if you have questions or concerns, you want to start with whoever the professor is for that course. In the event that we don't have a solution to whatever the issue is or concern is, we're going to move it to the course lead. We're going to involve your campus dean and also the online dean. But always start with us. Again, our information in the course leaders and then the online dean's information is in the About the Instructor tab. Now, for campus deans, you will have to seek out and determine who that is, because all of you all, everyone in this class does not come from this, is not sitting at the same campus. And so for your, pass that one. So this is our course leader here for mental health, Dr. Bug Cutler. So in the event, but still include me in the communication for your individual campuses, you have to determine who your campus deans are, and that most campuses have an assistant dean as well. So find that out this week, who they are, because, once we get to week 10, going into 11, once we get ready to do HESIs, you're going to need to be in close contact with them, because that's who's going to be scheduling your HESIs. Sometimes the HESIs, this class is not late as most classes, but sometimes HESIs are not given on this. And make a note of this, put a little star or pencil or highlight week 11. It's going to look a little different than the rest of your weeks have, because your HESI for your classes might not be on the same day and time as you've had your classes all term. Some may fall like that, but HESIs are campus specific. So just make note of that. And this is nothing you have to write down. This PowerPoint will be shared with you, and also our information is in About the Instructor tab. So like we just said, the course lead for mental health is Professor Bug Cutler, and then our National Online Dean is Dr. Sheed. All that information is there. So we talked about that. So we're professionals. So we want to keep this environment. This is a safe space. We want to be courteous of each other, respectful, even if we have differences of opinions. Is still a way that we can still share that information and be respectful to each other. Let's see. Okay, let's make sure we go over this part right here. So, misuse of substances, even if it's legal in your place, that community where you live, the virtual classroom, we vaping, smoking, and those things are not allowed during the sessions. We want to ensure that even the use of marijuana, if it's legal in your community during this session, it is not allowed. So the expectation is for us to be dressed professional. Do you have to be in a three-piece suit? No, but you should not have on pajamas. You should not have on see-through clothing or revealing clothing. So just make sure that you're keeping it professional, because even though we're not physically in the same space, we still are in this space. And mind you, these sessions are recorded. So I do want to tell you about the attendance, which you all know. You've made it this far, so excuse me, you already know that sessions start on Sunday. They go from Sunday to Sunday. So just keep in mind of when your assignments are due, and make sure that and I mentioned earlier, if you switch the class, make sure that you're in the correct class, because there's some of these classes we teach on the same day at the same time. So just make sure you're in the correct section, because we don't want you to get marked absent in a course when you're in fact in the wrong course. So just check your schedules, because there are several courses that occur at the same time on the same day. So just make sure you're in the correct place. So the lessons and adaptive quizzes, all of these things are a part of your weekly lessons. There are due dates in there. You have to make sure you can get into SurePath. Ensure that you can get into your Outlook. There are some students have made it all the way to leadership that last term, and they haven't had Outlook. So you're missing information, and information is being sent to you. We know you have email inside of your Canvas, but you need to make sure you can get in SurePath, Elsevier, and Outlook, the Outlook mail. Remember, attendance is recorded for all of these live sessions. We only meet one day a week. So in the event that you miss, that's a whole 7 days that counts. Now, we do know things to come up. So if something comes up and you're having to miss, to be late, get all of your documentation. If you're logging in, and like you first logged in tonight, this evening, that my connectivity did something. It started storming. So it kind of sounds like it's leveling off. So hopefully we don't lose connectivity, but I'm going to document that. Is there a question? Okay. So in the event that you have to step away, go to the restroom, or something's going on in your space, put a message in the chat to me to say, hey, I'm stepping away for just a moment. Don't send it out to everyone, because these sessions are recorded. And then what happens is everything is recorded in 15-minute increments. You're docked that amount. So if we're late 1 minute up to 10 minutes, 13 minutes, it's a whole 15 minutes. And over time, I know you all have heard this, but this is a reminder, over time, that chronic absenteeism, it can actually cause a whole full letter grade deduction just because of attendance. So making sure, most Zooms, usually we have our Zooms open at least 5 minutes prior to start time, sometimes earlier than that. So just make sure you log in and go, you have that few minutes to go ahead and finish up whatever. But can someone fail on attendance? These things are real. So that's why we're bringing this stuff out to you. So just make sure that you're logging in. And with all of your courses, make sure that it's the correct day and time for you. After you step back and look at all of your responsibilities and everything, a Monday might not be the better class. So, Friday might be a better class. But just look at everything, because over time, this attendance does add up. You may or may not get those notifications, saying, hey, you're at 5%, you're at 10%. But know that this is a thing, and the attendance administrators do keep up with that. You know about the academic integrity. Just stay away from those sites. they just stay away from them. I don't know who does it, but it is real. You all, someone sits there and monitors it. Don't even click the looking at it, see what they're looking at. Just stay away from those sites. Because remember, we're signing up to be a healthcare professional, and it's an honor system. And so we want to be equipped with as much information as we can, have that strong foundation, no matter what setting we end up working in, that we can provide that best care for our clients. So stay off those sites. They're being monitored. That's what these slides are saying. Even if you use AI for any of your assignments, you have to get permission. You have to show your work plus the AI work. And remind you, I'm going pretty fast with these because most of these you've heard. Just want to just bring up those things back to you. So that was for 206. We're going to skip through that. Okay. So for those of you that have classes that you have to write those papers for, even if you're doing PowerPoints, making sure that you are citing those your references. Okay. So late work policy, submit on time. Every point matters, you all. So but things happen sometimes, right? And so even though you have that Sunday to Sunday, it's okay to turn that work in on a Saturday if you're finished with it, or Friday. Go ahead and submit it. But in the event that something happens, late work is only accepted with prior approval from the instructor. So put it in writing, just let us know what's going on, and more than likely we'll grant you permission to go ahead and turn it in. But within a 1 to 7 day window, you still receive that 10% deduction. So even though you would have made 100 on that quiz, even though you made 100 on that quiz, because you got the assignment the quiz was turned in late, the highest you can make on the quiz will be at 90 because you're going to get that 10% deduction. So, and we want all of our points. So just make sure that you're looking at that, your time when you're sitting down to take those adaptive quizzes. So as I initially talked about, to look at those things that have helped you do well thus far, those study habits, reaching out for tutoring. Some of you all have like groups that you all text and do things in, but whatever that's helped you to do best. Now, some things slow you down and didn't work out well for you. You don't want to do those things. So, of course, always be logging in and looking at your announcement sections. If something comes up that you need to know, that's what we're going to place it in that announcement section. So just making sure that you're looking in there pretty regularly. Okay, let's look at this right here. Okay. Now, Dr. Bud, with this review session, we have the exam in week 3. So I'm gonna tell you what week 3. I know this is week 1. I'm gonna tell you what week 3 look like. I know y'all said, "Oh my goodness, we're doing this really fast." But week 3, so we come to class. Of course, that's the week of the exam, right? And so you're gonna take the exam at the end of class. You have that 75 minutes to take the exam. Prior to the exam, we review some content and we review the exam. And then you take the exam. So we come in, we review everything, and then you take the exam. So that's what week 3 looks like. So it is in week 3, and we review content prior. But Professor Buggs, I got a note here. She says she will be hosting an exam review, and the time and day is to be announced. So make sure, she said most likely a Thursday evening or a Saturday. But if you can't attend that, I'm sure the sessions will be recorded and the links are sent out. So at a minimum, just make sure that, you're at least viewing our classroom recordings. And if you can, when she sends those notifications out, it's going to be in the announcement section, attend those sessions if you can. But meanwhile, if there's a concept or something that you have a question about, feel free to send an email. We can jump on the phone. We don't have to Zoom. Don't think we have to Zoom if you have a question. Okay. All right. And this is just all along. Hopefully you just been looking at your NCLEX questions all along for all of your courses, just going back through. I'm not talking about the ones that were just assigned, because remember, you're headed to providing that best care that you can for your patients, sitting for NCLEX one time, and then, doing really well in your classes. So besides what's required, take a look at those NCLEX books that you have on your bookshelf and just start looking at 1 or 2 questions. You might have to come up with this study timetable. You just come up with whatever works for you. Okay. So keep in mind that your unit exams, they cover 60% of your grade. Every point matters, you all. And then the HESI is 20%. That's a lot. But nevertheless, that's what it is. So, and I say that because can a student fail on attendance? We've already said yes, it can drop a person a whole letter grade. Can a student pass all their exams and then get to the HESI and bomb the HESI and fail the course? Yes. So I'm not saying that to scare you, but just to make you informed about, hey, let's, whatever it is that we need to do going forward so that you can be equipped so that you can do your best on these exams. And then you know that your KGA has to be 78% without rounding, in order for your homework to even be considered. Okay. So this right here, before any credit is given for completed homework. So, you may say, well, hey, turn the homework grade on. If you turn it on, I have higher than the 78%. You must have that 78% outright with the key graded assignments first. So usually, we have the homework scores turned off. Week 6, week 6, 7, we turn them on. So you can see the impact when we turn them back off. Okay. So of course your exams are proctored for this class. In the event that you think that you need that exam proctored on campus, be thinking about what's going to work for you. Step back and look at your big picture. You know what day it's going to be on. It's week 3 and it's toward the end of the class. Only thing you need to do is at least 72 hours prior to the day of the exam, you need to find a faculty that's approved by your campus dean. I don't approve them. The online dean, Dr. She, does not approve them. Our course lead does not approve them. It's your campus dean. They have to approve whomever that it is. And also they need to find a place for you to take that exam. So this is if you're planning on taking that exam on campus. So be thinking about what's going to work for you. Accommodations, we do have a couple of slides on that. So I'm gonna come back and talk about accommodations once we finish this. Okay, so exams, we ask for the ID prior to we ask you to see your space, remove all what do you call those devices, those smart devices and everything. Y'all take those things off. Even when you go into those HESIs, don't forget to take those devices off. We don't want you to get in there and take the exam, and then at the end of the exam, you realize you have that device on, and exam is not valid. Okay, stuff happens. We hope nothing happens and everything flows how it is scheduled. But in the event on exam day, something happens. Flat tire, I don't know, not feeling well, an issue. I like to say an issue. When you write in, you fill in whatever issue is. Whatever that will not allow you to do your best. If something's going on, please share that. No matter if it's physical, mental, it doesn't matter. Because what happened, I'd rather reschedule the exam because we do have, where's that thing at, that 1 to 7 days. We have to take the exam within 7 days. So I'd rather get the 10% deduction and you do your best on that exam rather than you come and take that exam and something's going on and you don't do your best and you bump the exam. But, we let you know, you make that informed decision and we support you along the way. Even if during the exam something happens, I wouldn't try to push through because more than likely, if something's going on, I'm not going to do my best on the exam. So stop the exam. Usually there are 2 or 3 of us in the exam room. So just let one of us know and we'll remind you of this on exam day. And so, but like I said, hopefully nothing happens. You have your HESIs, you have that 1 attempt. It does count as 20% of your grade. So even from after week 1 for your classes, just start, if you're enrolled in 2 or 3 classes, however many classes you're enrolled in, just start going back, sifting through that information, because remember the HESI is all of it together, all the content. So we just started the personal learning plans. HESI remediation was based on time and your score, but now it's based on this plan. So the plan is created to sift out all the things, the concepts that you might need a little bit more foundational knowledge on. So that plan is there to help you move on to that NCLEX so that you can do well on the NCLEX. So you have to have that plan finished. And how it goes is if you make 900 or above, it usually has 4 readings or videos for you to complete, a case study, and 5 quiz questions. So we'll post this again once we get to week 11. Okay. You need your ID. So yes. Was there a question?
No, I was just saying, thank the Lord.
For what? The time thing
Yeah.
with the HESI?
Yeah.
Oh, okay, yes, because that this is totally different. Yeah, yeah, that this is totally different because if you even if you scored a 900 or above, you still had to spend at least I think an hour, 2 hours in there. And this right here, I don't think takes that long. But the bigger picture is we want to is picking out those things, those concepts that you need a little bit more foundational knowledge on. So because remember on these exams, we don't know how or what content, or we know the content, but we don't know how they're going to ask you, what question they're going to ask you about the content. We know next gen is a factor. So if you have a strong foundation, no matter how the question is presented to you, you'll be able to sift through your nursing process, your critical thinking, your clinical judgment, and you'll be able to answer hopefully correctly. So that is there is a method to the madness. That is there to strengthen your concept, your foundational knowledge. You don't have your IDs, get your IDs. You're going to need those things. Okay. Again, contact us if you're having any problems or any issues, or if you just want to talk about whatever it is we need to talk about. It's nothing is too big or too small. One student had she needed to get her calendar in order. She had a paper calendar, electronic calendar. Well, once she got that in order, she was fine. The phone call didn't take that long. So, but do whatever it is that you need to do for you so that you can be successful. Okay, so week 1, let's see what this is. This is the maternity one. So let's go over here. That's peds. Mental health. Of course, we're gonna go over these topics. Everything is here, everything is in your modules. So you don't have to guess about anything. Access your assigned patients through the Canvas link. So when you see like this little symbol here, just click on this and it should take you on into your short path through that link. So don't try to log in outside of your Canvas shell because I think sometimes you end up on a different assignment or something, but they say log in, click the link, and it takes you on in there. Okay. All right. Professionalism. We talked about that. Make sure you're on time for class because that 1 minute, 2 minutes turns into 15-minute increments. We do want to be respectful. We want to dress appropriately. Each week you will receive feedback through your professionalism. So that's a grade every week. So make sure you're looking at that. Make sure that you're on time, completing your assignments. And this is the professionalism rubric. So just look and grade yourself. Hey, did I participate in the chat? Did I come off mute? Did we do the small groups? And this is just so that we can hear from each other because believe it or not, even if we're not trying to learn anything, but we're here trying to learn and gain a foundational knowledge. If we hear things so many times, even though it's reworded and we're saying almost the same thing, it strengthens that foundational knowledge. It helps us to better understand. And also it helps us to identify, well, hey, I really don't understand that concept. We can talk about a little bit more. So we use chat, we use the wheel, we use small groups and all of that. But nevertheless, we'll get through it. Are there any questions?
Yes, I'm sorry, Professor. So my understanding is we are going to be with you for like 3 weeks for the mental health block, and then we'll continue on to like another block with a whole new professor for 3 weeks, and then the other block for another 3 weeks.
That is correct.
Okay, thank you, Professor.
That's the revision. That's how this is the revision. That's how it goes. Yes.
So
So
it's
three
just
weeks. And this is one of our 3 weeks. So we're almost halfway there. So yes.
yeah. So it's just 9 weeks of us doing like each of our blocks, and then the last couple weeks is going to be mostly HESI review or something
Week
like that.
11. Week 11.
Oh,
Well, usually weeks 10 because our last exam we pull up. Let me go to our course shell here. Let's go to the modules. And I'm going to share my screen here. And that way you can see exactly. So on your schedules, I'm not sure what does your schedule say for this class? Does it tells you does it have mental health listed first? Does it have an MH listed? What does your schedule look like?
Mine has a little bit of everything all over the place. I'm getting messages from this professor and this
Okay.
professor. I don't know what's going on. I'm
So
just
So
for
when you look
for
at
this
your
class,
original schedule where the blocks are and you click
hmm
on the blocks, it'll tell you for like week 1 through 3,
hmm
it'll keep saying like Miss Ford's name. And then if you go further down where you click next, where the class schedule is, then
hmm
it'll start switching to the different professors so you can see what comes next.
got it. Okay.
okay.
So I was trying to see what I see on my end.
So
So
this is mental health.
this is mental health for 3 weeks. Yes.
Okay, I've been doing the wrong work.
Yes, it's mental health.
Lovely.
Okay. So
Let's do the
then
mental.
next is OB. So weeks 4, 5, and 6 is OB. And then your last 3 weeks, look at your schedule and make sure I am saying it correctly. Then your last 3 weeks is peds.
What other classes do you teach, Professor?
Oh, geriatrics, RN classes, just a number of classes, but I'm talking about for this course right here. I want to get you confused. So for
Okay.
this, the rotation for this right here, for this section, because we're in section C, we start off with mental health. Do you show that first? Are you in section C? Does your schedule say section C, P2C?
Where do you see the letter C, if it is?
On your course shell. Now, that's why I say my view might be different from yours. Let me just show you what I'm looking at. Let's see here. So just to make sure you're in the correct course
It would be
section, because there are several of us teaching the same thing at the same time on the same day. Okay, right here. Does your schedule say this right here?
I can't see that. Oh, there you go. Let me see.
Piece 2C. And if you
Let's see.
switch courses or days, you just want to make sure you're in the correct place.
Yes, ma'am.
Okay.
It does.
Yeah.
Thank you.
Okay.
P2C.
All right. So with that being said, you will have mental health weeks 1, 2, and 3. Then you rotate to OB. You're still in the same section, but we just change out the professor. I move on to a different section. You stay where you're at. Then you have OB, and then you'll have peds. So weeks 1, 2, 3 is mental health. 4, 5, 6 is OB. 7, 8, 9 is peds, and then week 10 we do the review, the HESI reviews, and then of course HESIs are week 11, and then we all meet during week 12 for just a few minutes for attendance sake. So yes, remember this is accelerated and we move kind of fast. There's a lot of information, but yeah, this is how this course goes. You see, we're gonna be together, and we're almost halfway past our 3 weeks. Well, halfway through rather. So, all right. Any other questions about are you supposed to be, is your section correct? Another thing to think about, you all, if you change sections, and this is for any course, when you log in, we don't have access to ExamSoft right now. When we do have access to ExamSoft, if you change the section, make sure that it rolled over to ExamSoft. Every now and then, doesn't happen that often. The section might not roll over to ExamSoft. So when you log in to do what you need to do in ExamSoft, you can't do it because you're in the correct course because you changed sections and it did not roll over. Okay, that doesn't happen often. Just a few times it's happened. So again, remember for exam reviews, Professor Bug, she says she will send out the information. Just read her notes here when she will actually have that exam review. And then if it's recorded, then she'll share the link. But just make sure that we're going back through our classroom recordings here. All right, so let's go ahead and get into our content. So again, some of you, I know the Zoom did something at the beginning. Make sure you place your name and campus in the chat. Check your screen name. Make sure that it matches how it appears actually on the roster. You know, if you're undergoing a name change and it has not officially occurred, then you still have to list your name how it appears on the roster, because you don't want to be marked absent when the attendance administrators look and they say, well, hey, Betty Lucky was, not in class, but we saw Betty Harry in class. Well, that doesn't match their roster. So just make sure if you haven't, and if you know that your name has changed, you need to go through whatever documentation it is to get it officially changed on the roster so that everything matches. Because even with HESI, you might have a problem logging in to Elsevier or finding your exam because it's listed on a different person's name. That doesn't happen very often. Usually, people go through that. I wanted to say accommodation. That's what we want to look at. Let's look at this accommodations, you all. So if you have accommodations, make sure you let your professors know every term, send a approved letter that details whatever it is that we're supposed to accommodate. So this is, let me pull this up, and all of this is in your announcement section. Let's pull it up. Okay. If you don't have accommodations, you think you might need accommodations, the process is here. The information is inside of it should be in all of your course shells, but I know it's here. So I placed it there. And so there is a process to it. Okay. Okay, here we go. All right, so need testing accommodations. If you require testing accommodations, we're here to support you. Before accommodations can be used, you must have a current letter from your healthcare provider, approval from the campus president of academic affairs, a signed letter of accommodation, and provide the approved letter to your instructor every term. Accommodations cannot be implemented until all required documentation has been received and approved. So if this is something that you think you might need, you want to start that conversation this week with your campus dean to seek out and your healthcare provider so that all that information they need can be provided. Okay, and then this right here just says submit your accommodation letter during the first week if you already have one, because what happens is whatever your accommodations say, if it says something for exams or quizzes, then when those are set up, those accommodations need to be placed in there. It needs to reflect what your accommodations are. So make sure that you're getting that information in early on so that the systems and everything matches. Because if you require accommodations, we want you to do your best. So we need everything to be there, and we can't do it if we don't know that what is actually needed. So these 3 slides are actually in your announcement section. Okay. All right, with accommodations. So let's go ahead and start looking and then we'll take a break every hour is how we kind of said that we would do it. So I'm watching time because we do need to get up and move around. But if in the event, make sure you're on camera. I didn't say that part. I need to say that part. You need to be in view of the camera. Making sure that you're not at work, not in a public setting, making sure that you're not driving. It's just a safety
I have
issue.
a question. I'm sorry.
Mm-hmm.
We gonna be on here till 9:06.
That's what the Board of Nursing says you have to.
Oh, okay. I'm just asking. Okay.
Yes, ma'am. That is correct. So, but what we have done in the past is, you have this certain amount of break time. Usually like that third break, we lessen in time. So we push the break time most of it towards the end. We don't get out early. It's just your break time and we push most of it toward the end. And so the first 2 hours, we usually do 10 minutes in between those. And then the last one, we do 5 minutes and then we push our other 10 minutes at the end. So you get your break time, it's just pushed toward the end. So, but
okay.
So
excuse me, because I'm also parenting over here too. So if you see me yell out in the back, just ignore me.
That's fine. Just be on mute, honey. Just be on mute. And so, yes, Board of Nursing says, you wonder, well, how this class, we sit for this amount of time. Why do we have to go to this many clinicals for this class? The Board of Nursing tells us what to do because they have gathered information and says, hey, we need to be exposed to this amount of clinical. We need to be exposed to this amount of simulation and so forth and so forth. So yes, that time is correct. It's correct. And mind you, this is a revised, and we're only together for 3 weeks. So, and part of that 3 weeks is an exam. So it's like, so yes. So it is really not enough time if you ask me, but we'll stop at 9:06 before then, more than likely, because we'll push that at least 10 minutes toward the end. So, But if you need to step away to the restroom or something's going on in your space, put a message in the chat to me and let me know what's going on. Don't send it out to everybody. All righty, so let's get started here. I have we're gonna talk about, look at that, my little notes here. Lined up here. I must have put my little thing in backwards. Oh, I sure did. Okay, so we're gonna start off with managing anxiety, depression. We talk about, of course, medications for those, and I think is that all of our content. Doesn't seem like a lot of content, but it is a lot. So we got anxiety, depression, mood disorders. That was the other one, and depressive / bipolar disorders. So let's go ahead and get started. Pull up my PowerPoint here. Is there a question? Let me share my PowerPoint. Chapter 18. And then you have all these PowerPoints in your course shell. Only thing I do, I just add some color to them and maybe some pictures or something. But it's the same content though that we have. So when we say, when you hear the word anxiety, let's just use our chat for a moment. We'll give you 2 minutes. When you hear the word anxiety, or if you were trying to explain, get my little timer pulled up. If you're trying to explain to someone what anxiety is, what would you tell them? Have you all anyone tried calling me since we've been in class? Because I have an unknown number on here. Anyone tried calling me? Okay. All right. So going back to the question, I know sometimes like the internet went out. You all are really good about checking and make sure everything's okay. So in the chat, we'll give you 2 minutes. Let me state what you're responding to. If you're trying to explain to someone or having a discussion about what anxiety was, what would you say to them? Okay, 2 minutes. And it could be as long or short as, but just whatever you put there that they will understand or gain some understanding about what anxiety is. I'm going to go on mute so you can concentrate. What your responses are. 1 minute, 20 seconds left. Okay, remember, this is a way that we show that we're participating. So make sure you put it there. You should have a minute. You don't have to type, a paragraph or anything, but whatever it is that you want to say to that person. All right. And then, so for these responses, send them out so everyone can see them. And then you all make sure you're looking at them. Because remember, as we repetitiveness, it's just going to stick with us. Even though we're all saying the same thing pretty much the same way, we just rewording a little bit different. It's going to stick with us. So just make sure you're sending that out and you're checking out what your classmates are actually saying. Okay. Okay, looks like I agree with what is there. Great. So anxiety is that feeling of uneasiness, uncertainty, and sometimes even helplessness. Just like, oh my goodness, I can't. A normal emotion, our time is up. A normal emotion response to a real or imagined threat or stressor. Okay. And then sometimes that little anxiousness that we get or that little uncertainty, it may warn us that there might be some danger ahead or to make us think about, the environment that we're in. Like, for example, if you hear, like last night during class, it initially when we started, I heard this loud thunder and I saw like a flash, like, uh-oh, got a little uneasy. I started thinking about the connectivity because class had just started. Never mind, what could if it was a storm that had tornadic winds. Thankfully, it didn't. But so anxiety is a thing that helps you. It's kind of so. Is anxiety a good thing or a bad thing? You can come off mute and tell me that.
It can be a good thing depending on the situation.
Okay. And it kind of can help you start thinking through because when I heard the thunder and I saw the lightning flash, I was like, okay, what to do? Got my other device here because I didn't want to not be able to give the students what they need at the same time. I was like, okay, well, what if I need to take shelter? So so it gets you to thinking through things through. And so can someone have too little anxiety? Is that such a thing?
Probably like the people that have like a lack of social anxiety. That's a thing. I've heard of that. Like socially, they just don't commute. Like you ever have somebody that be talking and you having conversations, everybody laughing and joking, and they really don't know what happened. Like they just standing there froze. I've heard of that type of anxiety, like social anxiety, where people have lack of.
I agree. So a person can have too little anxiety because remember what I just said about hearing the thunder and the flash. That little uneasiness made me start thinking about what to do, what could potentially happen, and so correct. The person can have lack of focus. If we're in class or we're in simulation or you're in the hospital setting, you're working, and they call a code. If a person has that lack of focus, the code has been called and we're running trying to do whatever our task is, and that person just sitting really by, and so that can lead to recklessness. It can lead to negligence. But what about on the other hand, can someone have too much anxiety?
Oh, yes.
Okay.
Me,
A lot of the times they call that ADHD, but we're gonna let them pass with too much anxiety.
Okay, too much anxiety. So what could happen if so we said someone have too little, they may not have focus, it might lead to recklessness. But what if they have too much, what could that potentially lead to? That person doing what?
they can shut down. They can become so distressed that they end up having panic attacks, stuff like that.
Never being able to relax, always have a constant fear of something about to happen.
And
And
so that
hyperventilation.
go ahead, Miss English.
Hyperventilation and stuff.
So
Like
those things
breathing.
that you all just described, what could it potentially lead that person not to do? Could lead that
Interacting.
interacting or completing tasks at all. That person, if it's too much, that person might not be able to complete just normal activities of daily living, getting up, going to work, taking care of the child, feeding the dog, doing laundry. And so, yes, too little and too much both can be have a negative impact on someone. So, but we did agree that we do need some. Okay, so reactions to anxiety occur during a continuum of behavioral responses. Responses to anxiety occur over 4 levels. It's ranging from mild to panic. Okay, mild. I don't know if I would call last night what I experienced mild, but like I said, did maybe think, okay, we're in class. Then at the same time, it's like, okay, do I need to be taking cover? I didn't hear any sirens and nothing came to my phone. So I was like, okay, y'all, but if I lose connectivity, you all just stay right there. I'm going to log back in because more than likely that weather was going to impact the connectivity. So, but then if I was in panic mode, I would just close this Zoom down, get your lesson the best way you can. I'll see you all next week. That would have been an example of panic. So anxiety occurs as a result of the perceived threat to oneself. So how are we perceiving that weather, hearing that thunder and seeing the light? How are we perceiving we're out on that walk and we hear the dog bark, but we don't see the dog? How are we perceiving that threat? Um, Types of anxiety. Learn responses to an anticipated event. Anxiety state. Individuals' coping abilities become overwhelmed and emotional control is lost. Is what we just said. So you all were spot on with that. Ooh, this one didn't come out right. Let me see what it's supposed to be saying. I need to, when I added the little fanciness, I messed up. Okay, so physical symptoms. So this is good. This one's messed up. So tell me, in the chat, just drop one symptom that a physical symptom that a person might experience if they have anxiety. A symptom. So a symptom that someone might be experiencing if they have anxiety. So you are tremors, sweating, hard to breathe, rapid heart rate, okay, fast heart rate. Muscle tension is one of them, fidgeting, headaches, sweating, got it. Problems with sleeping, and kind of sometimes you go in that fight or flight mode. Okay, so coping mechanisms. So do you know of, and now you can come off mute, and do you know of any coping mechanisms that we more than likely would implement with, because we've done our head to toe assessment, we gathered all of our information, we have this nursing diagnosis, we plan. So what do you expect some interventions for us as a nurse to implement to help this client cope? What do you think?
Deep breathing exercises.
Deep breathing exercises.
Guided imagery.
Guided imagery. Okay.
Getting more sleep, possibly.
Okay. Encouraging them. So how would they do that? How would they get more sleep? What's some things that we're going to reinforce with our teaching?
A good routine.
Okay. A routine. Think about those things they tell us not to do before we go to sleep. What they say about exercise. Go ahead.
Don't eat a big meal before bedtime.
Okay. What about exercise? Should we be exercising?
You exercise, yeah.
Should we be doing an exercise routine prior to sleep time?
No, like taking a walk, maybe.
That's just a stroll is different from a whole exercise routine. Just think about if you're exercising, lifting those weights, you're doing jumping jacks, you're jumping around, you're getting everything riled up. We're trying to dial it down so we can get that sleep. Good. So what about screen time? What were you talking about screen time?
Put your phone away.
Okay. And it is, have you all paid any attention to that? If you have your phone and you're looking at it close to, and it's like it speeds things up. I was like, oh wow. Need to they're right about putting this phone down, because it's taking me away from that rest and relaxation. It's actually making things speed up and making me think about, well, what we're gonna do for this, what we're gonna eat, what all these different things. So good. So great coping methods that we will be implementing. Okay. All right. So defense mechanisms, psychological strategies that help to lessen that feelings of anxiety. Goal is to reduce the uncomfortable negative emotions. So some people, it might just, erase it all together, but hopefully those coping mechanisms would at least lessen or decrease that. Okay. So a person's in crisis mode, that is where that person's ability to cope with anxiety is just overwhelmed. They cannot complete those tasks that they need to complete. Those tasks could be, cooking, washing dishes, taking a bath, actually sitting down and eating. Okay. So self-awareness and anxiety. Anxiety is contagious. I don't know if you all remember being and you all may be too young for this, being at the schoolhouse, and either they did the drill overhead. It wasn't a drill. It was actually the alarms went off. And you have to come out of the room in a single file line, get in the hallway, and they tell you, hey, everybody be calm, line up and all of this. But if that one person that one child or that one person gets riled up, then it's a domino effect. It becomes contagious. So as that nurse, it's going to be important that we recognize, think about those signs and symptoms that you dropped in the chat. And so we go ahead and be proactive. When we see the clients fidgeting, we if they're a patient for that day, and we've come in, the unlicensed personnel has come in and set them up and reminded them about their bath. We come in 30, 40 minutes, an hour later, and they still haven't. So think about those signs and symptoms and go ahead and be proactive, and go ahead and start discussing coping mechanisms and try to lessen that anxiety. Do we need to discuss anything? Are there any questions? Anything that we need to talk about? Okay. And so that hopefully this client or the patient can actually move forward with taking care of themselves. Like I said, the anxiety might not go away altogether, but hopefully lessen so that they can complete those activities. We do have all these theories here that are related to anxiety. We have theories with all of our concepts, with all of our different levels of care. And these just guide what we do and how we provide those interventions for our patients. So anxiety in childhood, related to a child's developmental level, problems associated with anxiety in childhood compulsions. We're going to talk about phobia, separation anxiety, over anxiousness, avoidant behavior. So we can see anxiety in children. In adolescents as well. Adolescents who ineffectively cope with anxiety often express themselves inappropriately. Many initial symptoms of schizophrenia and other psychosis begin in adolescence. Sometimes, we might overlook or say, that's just Larry being Larry, but it more than likely, it could be, signs and symptoms of anxiety, schizophrenia, or some other type of mental health disorder. So we do want to establish those therapeutic relationships early on, you all, with our clients, no matter what setting we're in. Even if you're in that urgent care center, if you're at you're the school nurse, if you're at the what do you call that? What kind of nurse is that? It escapes me. The occupational nurse. So no matter what setting you're in, people might experience or have these disorders. So just keep it in mind, establishing those therapeutic relationships early on, they are more likely to open up and tell you what's going on. And then they're more likely to comply or listen to, or try out at least the interventions. Like we said, get more sleep. Well, hey, decrease the screen time. Don't eat the meal. Get in your routine. So they're more likely to try those things out as coping mechanisms. Because at the end of the day, people do want to truly be healthy, productive individuals. And so we just need to find out what's going to help us to be that way. A few more minutes and we'll take our first break. So, okay, let's see here. And remember, all these slides are in your actual shell. I just added color and things to mine. All right. So diagnosis of anxiety disorder is based on a description of behaviors that express distress. So what is distress? Is distress and anxiety the same thing? What do you think? Someone's in distress.
Distress is worse than anxiety.
Yeah, I think it's a little bit step up. Exactly. So what about this generalized anxiety disorder? Is that the anxiety that we were describing earlier, or this right here is this one of those not nursing diagnosis, medical diagnosis? Is generalized anxiety disorder a medical diagnosis?
Yes.
It is. Okay. So once somebody is described as having this, and their fear and their anxiousness is more than the example that I gave last night, when when I heard the thunder and I saw the lightning, it's a little bit more than that. It's to the point where it's preventing that person from being active and taking care of themselves and completing tasks and things like that. But it does not say that we cannot find the correct coping mechanisms or medications that can, get the person to be productive. So I want to stay on time. So I have 6:30 Eastern time. So we are going to pause here. We're going to take our first 10-minute break. During this break, the recording still plays, you all. So make sure you're on mute and turn your cameras off. So we'll see you back at 6:40 Eastern time.
That is funny.
All righty, let's come on back. Let's finish up this content here. And then we're going to move on into a Kahoot after we finish this content. Let's see here. Okay, I'm going to share my screen.
Excuse me. So those messages that we got about downloading the Kahoot app and the little charts and keys and stuff for mental health, we use that for you as well. It was posted by John Maddox.
Dr.
Yes.
Maddox,
Okay.
yes.
Dr. Maddox. Okay. Thank you.
You're welcome. Yes, anything that you see in that course shell, all things mental health, even if I didn't post it. Yes. We just have different people have different learning styles. And so we add in Kahoots. That is one of the resources that we can use. So we use Kahoots. Sometimes we spin the wheel. Sometimes we do, small groups and things like that. But we just place all these different resources out there. So just to strengthen that foundation about these concepts here. All right, let's finish up. Okay. So what is the difference? So what is obsessive compulsive? We have the definition there, but what would be your definition of, if someone has obsessive compulsive disorder? What might we see? What would be the definition of that?
Someone that's doing something over and over again and they're still not satisfied, so they have to keep doing it in order to try to feel that satisfaction of doing it.
Okay,
I don't
thank
know.
you.
Yeah,
Okay,
like somebody who has a ritual that they need to perform in order to continue on with their day.
okay,
Just being obsessed with doing something. That's what.
okay. So now give me an example.
When somebody
Like
constantly thinks
cleaning
about
up.
something repeatedly, when somebody can't stop thinking about something, like maybe something you saw and you keep thinking about it over and over and over and over.
I have a good example.
Keep washing hands.
My mom used to have a gas stove and she would constantly, before she leave the house, she would check every dial to make sure the gas stove was off. She'd be like, off, 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 off. And she'd turn around, she'd be like, nope, off, 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 off. Like she had to make sure it was, off for safety. But that was her OCD.
Are you sure? She just making sure that gas was off. Okay, so
Now,
if she
that kind of
checked it
religion.
once or twice, so because that's a dangerous thing. So if she checked it once or twice, but if she turned around and had to check it 5 times, or she says I gotta check this 6 times, or if the person
Yeah.
washes your hands
Yeah.
and say, hey, I gotta wash my hands 5 times before I eat, or 6 times, or
Yeah.
so yes.
Yeah, she could do it multiple times. It wasn't just 1 or 2 times for safety. She rechecked that thing a million times before she would leave the house.
Okay. So it's whatever that specific behavior is. Some people in people, you will see all different things that people would do, and so like I say, washing the hands is a real it's a common one that we see. Checking the doorknobs, make sure doors are locked. That's one. Just you'll just see, but it's that repeated, and it's like a irrational repeated behavior that the person is having. It's off, but I need to check it 7 times to make sure it's off. Or I need to, I've washed my hands appropriately. I haven't touched anything, but I need to wash them 10 times. That's kind of irrational to think that you need to wash your hands at 10 times. Okay. And so go ahead. Someone has another example? Thought I heard someone talking. So what could that obsessive compulsive disorder lead to?
Like skin breakdown or loss of time.
Exactly. So those, like getting to work, completing the chores at the house, getting the children to school on time. It could just domino out of control. That repeated washing, it can lead to a breaking down of that skin. Then if that person is a diabetic, that sore, that wound is hard to heal, and it's just domino, just out of control, out of control. The person's never leaving the house because they keep going. They have to go back 10 times. Then they're late for work. Some jobs have it where you get a point, or this if you're late, and this if you're late, and eventually it leads to the person losing that job. So going back to those, identifying early on, establishing those therapeutic relationships, so your patients can, open up and tell you what's, really going on. We identifying and implementing those coping mechanisms, and that works for them, because all coping mechanisms doesn't work for everybody. And so that those persons can be productive and live productive lives. So yes, you do see the skin picking, the hair pulling. They're all different signs and symptoms that people will actually display. I forget what they call it. Well, one patient we had, they were actually something about the hair on the eyebrows, in the eyelashes, something about those, not the hair on the head specifically. When one grow back, it was pulling it out. So, and over time, that led to that skin being opening, sores on the face from that repeated pulling, because those things are there to protect us. And so, but if that compulsive disorder led that person to pulling those hairs out, over time, that skin was affected. And just think about the appearance. They have all those sores and everything, and think what that adds to the compulsion. And so, but nevertheless, post-traumatic stress disorder. What's happening when someone has post-traumatic stress syndrome, or what has happened, I will say?
Trauma plays over and over in their head or something.
From a past event, exactly. And so that in itself can prevent that person from moving forward, being that productive individual. If they get in that similar situation, they completely shut down, unable to move forward to complete whatever task that's before them. So PTSD, post-traumatic stress disorder, usually occurs after an individual experiences or witnesses severe trauma that is terrifying or life-threatening. And that is whatever that person perceives as terrifying or life-threatening. It's not all the time that they were involved in gunfire or they had a horrific accident. It's whatever they perceive as terrifying or life-threatening. And so the person can become emotionally numb, and then easily startled. And then when it happens, they envision whatever that moment or that experience, then they can shut down and not move forward with completing tasks. So rape trauma syndrome, the same thing. We still need to provide the emotional support, being that advocate, establishing those therapy relationships, and seeking out what resources are there for individuals. Many communities, their resources, just the community resources, because once that patient leaves that hospital, what do they do? Where do they go from there? So we want to identify those resources, work closely with those that are the others that are on the healthcare team, the social service, there are different nonprofits. People have these programs and resources that people can, utilize after they leave the hospital. So we want to just make sure that we're making them aware of that. So prevention, most effective way to cope with anxiety. Mental health therapies and medications frequently are used as treatment. So we do want to collect that data. And then we have this thing called cognitive behavioral therapy. Helps the clients to understand that ineffective behavior and replace it with more successful behavior. So they kind of put them in I'm talking about the systematic. So the cognitive behavioral therapy is where we identify those coping mechanisms and try to maybe do like a role play and help that person to trade out, their normal responses with some better responses. the systematic desensitization. Now, this right here, I get I try to anxious about even talking about it. But for example, if someone's afraid of spiders, this is I don't see this very often, but it is a thing that some therapists use. Say, for instance, the person is afraid of spiders. So the person comes in for a session and they have pictures of spiders. The next session, they come in, they may have actual fake spiders or rubber spiders on the table or just around in the session area. And then the next session, they may actually have some real spiders that are encased in a cage or some type of, you know, something that's away from the person. But they do all those steps to try to desensitize that person to that fear that they get from seeing that spider. And so, does anybody else have any other examples of that where they have heard of someone going through this, where they try to desensitize you so that you don't have that same sense or feeling about whatever that stimuli that you're afraid of? I know spiders is a common one. They try to do that. And we're not talking about we see a spider, we're trying to kill it. We're talking about that intense fear where, the person shuts down. But that is a therapy that they try to use.
My mother-in-law has the fear of lizards real bad.
Of what?
Lizards. Like she
Lizards.
will literally jump out of her skin, crawl up a wall. She cannot do lizards, period.
Cats is another one that people are afraid of. I've seen, people, so afraid that they will actually hurt themselves trying to get away. And they lose all
Yeah, I was gonna say
sense of their awareness, like that there's a brick right there, that there's a car right there. They will literally run into the car trying to get away from the cat. That's another one. So now if you're afraid of it, okay, get away from it. But when it comes to the point where the person is going to cause harm to themselves trying to get away from it, then that's the issue. That's the problem. Have anybody seen where they're using the animals as therapy? Have you all seen those on your clinical rotations where they bring the animals in?
I've seen it at my job.
Yeah.
Okay. So tell us about it. You don't have to call your job's name, but just tell us about what you've seen, what type of animals and what they do.
It's a service dog that comes in, and usually they let the service dog come out into the activity room, and all the residents will, whoever wants to participate will go ahead and sit in a circle, and the dog will just walk around, and everybody will take a turn petting it and stuff like that. So it was a trained service dog.
Okay. Anyone else that have seen or experienced the therapy with the animals? So it's more so that touch, and then you see a lot of them, they encourage the people to touch. So something about the touch, and and it's like when you see them come around, it's like they stop whatever you're doing, and it's like you're refocusing, and it provides like that calming effect, or at least that refocus for the individuals. Now, being a nurse, you can do all kinds of things. You all be really, really creative. I'm seeing where nurses are yoga nurses, and they're big on meditation sessions as part of their yoga sessions. So just to let you know, it might be a thing that you're interested in, and that's one of the services that you can provide at long-term care centers, at what they call those wellness centers. And so while they do the yoga, the different types of exercises, that they bring that meditation part in as well. They don't call them yoga nurses, but essentially that's one of the services that they provide. And then of course we have medications. We do have medications. Some medications they do prescribe, so that in hopes that person, they start off like kind of low, and they build up and change out. They switch up the doses, which you all know that, just to see what's going to work for that person, because we don't want the person where they're not able to function and carry on. But we do want them so that their anxiety is lessened, so that they can be productive. But nevertheless, remember our nursing process. We're going to gather this information from them. We're asking those focus questions. We're asking that, we're going through that health history, gathering that information, so that and a nursing diagnosis can be established, and we can create that plan for that person, and we can implement and everything so that they can have problem solving techniques, relaxation techniques, all of that. Because we want to protect the client from injury to themselves and others. Like I said, that I've seen a person run from a cat. They were so afraid of it that they literally like did not see the car there, like running. So that person fear was such that they would cause harm to themselves, and then if the car was moving, the person would be charged with hitting the person and all of that. So it can potentially cause harm to the other person as well. So it's nothing to take lightly. So doing those thorough conversations and asking them, to share more, tell me more about what's going on. Okay, so now we're going to switch to a Kahoot. We only have about 10 questions here. So let me put it on the screen. Want you to log in. You don't have to log in with your whole name. You can just put some initials there. I am going, once I get it pulled up, I'm going to share so you can see the code. Excuse me, it's loading. It's loading. Get it. Right.
You want to log in with our phones or?
It doesn't matter, just long as you're in and you're participating. And you don't.
Sending us the link?
I am gonna share my screen so that you can see the join code. So you just go to Kahoot it. You just go to, or if you have the app, go to either of these, and then you put the game pin in, and you can just log in with your initials. So you can go to www.kahoot.it or with your app. It's going to ask you for the game pin. You just enter these numbers. And I haven't tried it with scanning the QR code. That might work as well. I'm sure it will.
So what did you say it was when they're extremely scared of something? Because my sister is extremely scared of cats. Like, left the baby, left everything to get away from the cat. What does
So
it cause?
is that fear? Is it rational or is it irrational? Is it to the point where, like you say, is she not taking care of herself and the child? Or is it just, once the cat gets out of the way or she gets out of the way, she still, carries on?
Once the cat is not in the room with us, she's fine. But if the cat's in the room, she's doing everything to get away from it.
To get away from it.
Anything. She doesn't care at all what happens as long as she's away from the cat.
So, nurse, what would be an intervention that you think we would implement?
Honestly, I don't feel like the desensitizing would help her.
Okay, but even before that, if you
I
have a
guess trying
cat,
to
if
get
I
her
have a
mind
cat,
off the cat,
so
but
if your sister was coming to my house and I had a cat and I knew that they did not like cats or were afraid of cats, what would be something that I more than likely should do?
Put the cat up.
Put the cat up.
Exactly. So, but if it's to the point of I put the cat up just because she knows I have the cat in the back room and she can't come in, and
yeah, she
that's
wouldn't
a
even
whole
come in the
different.
house. She wouldn't even come in your house if she knew that a cat was in there. Like,
Okay.
that's how scared she is. Like, a cat could be walking down the street, and it's stray cats everywhere. No, she does not.
Do we have everybody in? We're gonna go ahead and get started. Here we go. And I'm gonna try to be quiet on this one. Let y'all just look through it. And remember, it's time, but try to read and understand what it's asking you. Don't worry about the time. You want to answer correctly. Oh, this out the way.
Anxiety.
I thought I was in it, but I think I clicked on the wrong one.
The code is up here.
Oh,
You all are rocking with this. Good, good, good. Okay. Check your mic, you all. We're hearing something. Hold on, you all, just a moment. I'm not sure what we're hearing. Sorry, I put it back up there. I put it back up there in just a second. So you do want to check your cameras because we are in session. You ought to make sure that you're not being docked your points. So we are in session. And in the event that you need to walk away from the camera, there should be a message in the chat to me while you're not on camera. Okay, so I don't know if you already got a chance. So yes, you all did get a chance to read through this because I took it down. Okay. All right. Okay. Why is it not? Why is this not rationalization?
That's what I put.
Because he's not trying to make sense of it. He's just undoing it.
Undo it.
Okay.
I put
So,
rationalization.
okay. So when you're a test taking tip, when you're reading, you're like, you narrowed it down. So just go back and look at, okay, does this match? Does this really match what the situation is? If it does not all the way match, that's not the correct answer. Okay. So why is it not denial?
Because he's not trying to deny anything by taking care of her.
Okay.
He's like, oh, I heard her. She's hurt. I got to take care of her now.
Exactly. Okay. All right. Okay. Why is this not undoing?
Because
He's
he's
not
not
trying
doing
to
anything.
undo it. He's just trying to blame it on something else.
Okay.
He's not trying to fix it. It's your fault. That's why I'm doing what I'm doing.
Okay. So when you, there's another test taking tip, as you look at the different answer choices, just look at each one and say, does this match again? That was another test taking tip, the same way we just did before. Does this match? Just take each one of them, look at them separately. Does this match? And if it doesn't, that is not the correct answer. And some of them is just that, just like that. If it does not match, that's not the correct answer. So you go back to your foundation of what you know that concept is. If it doesn't match, is not it. Okay. So let's go ahead and move on to depression and other mood disorders. If you are not responding to the class as a whole, you all make sure that you're on mute. Okay, let's see me pull up. Okay, I think this one we have a few questions mixed in with it. Okay, so now this one we're going to look at some medications before we move on to the. We're going to look at some anxiety meds. All righty, let's share here. And you can just do some jot noting on your papers randomly. I will ask you all to share out, but at least just do some jot noting with the answer on your paper, A, B, C, or D. All right, from current slide. Okay, let me move this little thing over here. So, which fact characterizes generalized anxiety disorder? Give you a minute. So, and what we're doing here too is test taking tips, because remember you are time. Exams are time. So just on your paper, you can just jot A, B, C, or D, and then we'll show you. So 1 minute, if I can get the timer up first, sure. And let's see, how do we do? Okay, it often leads to other psychiatric disorders. Okay. Remember, I talked about that domino effect, just dominoing. Okay. On your paper, just do A, B, C, or D. So look at what it's asking you. Disabling. So I would have to go through my files and see, well, what does disable mean? Okay. Then I look at the answer choices. So when you look at these, all of these can disable, but the question said most disabled. So this is like a priority question. So when you have those test taking tip, when you have those priority questions, when you look at the answer choice, it's like, oh shoot, we can do this one, we can do this. We can also do this one, but it's asking you to select which one would be priority, because this one says most disabling. All of these things can disable the person from moving forward and being productive and taking care of themselves. But the one that's most disabling, if that person has to wash their hands 10 times, 7 times, check the stove 20 times, whatever it is, it would be most disabling for them to move forward and go to work and take care of themselves and their family. Okay. That's just when we're gathering that information. Remember, ADPOC, we're assessing, we're gathering information. We want to ask about the sleep pattern. How did you rest last night? Do you take naps during the day? How is your eating? Have you had, you eat 2 meals, 3 meals? What is it? We want to get that in-depth history from them. Okay. So drug therapy for anxiety disorders, treated with psychotherapy. We kind of talked about that. Short-term use of anti-anxiety agents, because if the person, they try out things and see if it actually worked for them, and then they will, they'll mix them up, because we don't want the person in the point where they cannot take care of themselves in the dose that they're responsible for as well. Okay. The avoidance behavior therapy. You see that a lot with people that have phobias. Okay. So treatment for generalized anxiety, the medications, you will see these, the benzos, the Lexapro. You all may have even administered some of these. Those are common. The Buspar and the Lexapro are common. Prozac, you don't see it as much. Okay. For panic disorders, you see the Xanax pretty often, or the Klonopin. You see those benzos more often, in the SSRIs as well. You'll see Zoloft. Don't see Paxil too much, but you'll see it every now and then. Okay.
Is those
So
drugs going to be on the HESI?
I don't know what's going to be on the HESI, but we do need to know, like, I do think you need to know, like, the categories that they belong to and what they're used for. Like, all the drugs and medications that you see there are anxiety meds. So that
Okay.
anxiety includes generalized, it includes the obsessive compulsive disorders. So kind of lump them like that classes of meds. Phobias. Well, that's the question. I don't have that keystroke, so I'm not sure I do know we need to know, like, classes of, like, these are used for anxiety, phobias, and things like that. So in the event that a person has generalized anxiety, or one of the phobias, obsessive compulsive, and they're on one of these medications, what would be some nursing teaching that you would do? So someone come off mute and tell us, what would be nursing teaching?
Depending on the medication, do not operate heavy machinery because it can be sedative. It can be a sedative. And also in the summertime, stay hydrated because the heat will impact your body with the medicine. No, ask me how I know, but I know.
Exactly. And so with that group of medicines for generalized anxiety, obsessive compulsive, the phobias, usually it alters, make that person things kind of slow down, so to speak. And so do want to advise people, hey, you might not want to drive, you shouldn't drive until we see how this medicine is going to affect you,
And limit alcohol.
and limit the alcohol, because what does the alcohol do to the medicine?
It's also a sedative, so it's going to co-enact with each other and make you even more
at risk for injuring yourself if you're driving, or someone is. Exactly. So just think about, those groups of medicines, how they work. And so in addition to the medicines we talk about, we want them to think about some coping mechanisms so they can lessen. They may not be anxiety free, but lessen it to the point that they can still be productive. Reduce that stimulation. Get more sleep. How do we do that? Don't eat those heavy meals. Decrease that screen time, and don't exercise, prior to going to sleep. You can take a nice little stroll. Let's see, how do we do? If a patient is in an outpatient clinic or hospital, orient the patient to the rules of the unit, involve patient and family in goal setting, foster health maintenance, and then patient self-assessment. Enlist patients' help with developing and maintaining a written record of monitoring parameters. So journaling, no one mentioned that. That's a big thing too. Journaling and writing down things, that helps people to refocus and organize, even if they have to reorganize it several times. So the benzos, these classes of medicines, what do? It's supposed to reduce the anxiety, right? And so what we see with that, that person might be drowsy. So we want to teach them about what we just said, Be careful with driving, operating machinery. Okay. So because it should decrease that level of anxiety, help that person to kind of slow down, refocus. You should see if that person is having what were the signs and symptoms y'all put in the chat earlier? That person's sweating, they can't breathe. We should see this lessen if these medications are being effective. That person, I think I put shorter breath in there, sweaty palms. Okay, so on your paper, just give you a minute. Just put A, B, C, or D. Okay. Benzos. All right. So have you all administered Buspar or any of these medications that we've seen on the screen? The benzo Buspar, what else do we have up there?
I take Buspar.
So what was the other medicines that you kind of really see? Sometimes it just depends. Well, the doctors, they're gonna try out what works for that person. And so, but they generally, you will kind of see if you're in a certain area, patients are, I don't want to say on the same thing, but they kind of see what at that moment in time, this is what's working for most people. And every now and then you will see those variations in there. Okay. But if the medication is being therapeutic, we should see less anxiety, more coping and improved coping skills, less anxiety, and so forth. Okay. So the selective serotonin reuptake inhibitors, the SSRIs. Okay. So they're usually used for short-term treatment, but they can be used, for long term, but it's usually short term. And then of course, again, we should see that decrease in anxiety. Don't see these as much. Every now and then, especially in long-term care facilities, you rarely see these anymore.
I take hydroxyzine. It works really good.
Because why wouldn't you see this in this? Think about our population. Let's consider our population. If our population is the elderly, and what we see on the screen with the hydroxine, what do you think? Why do you think that they are less used in the elderly population?
Because it drives them basically like taking a Benadryl makes them sleepy, and the hydroxyzine, I forgot the name of it, but it can make them dehydrated as well.
Exactly. Think about your population. Someone else was speaking. What were you gonna say? I don't know who it was.
It was the same.
Okay. So yeah, so consider your population. Think about your elderly. It's a mild tranquilizer, it dehydrates them. Once you get older, they say well, shoot, even before you get older, sometimes you just don't want to drink those fluids like we're supposed to. So the medication does that on top of the person not already taking enough fluids in. What's going to happen? More than likely, if they have to go out to the hospital, they're going to get admitted. They're going to get admitted with dehydration. Exactly. So that's why you would not see certain medicines in certain populations. Those that are up young and adolescents, not a problem with dehydration and things like that. You will see it in the younger population. Okay. But nevertheless, we should see that decrease in anxiety. Keep seeing that. Okay. Here we go. Let me set the timer. Just write down A, B, C, or D, and then we'll check yourself in just a moment. Okay, let's see. How did you do? What did you all just say? Yep. All right. Let me restart my timer. All right, just read through the question. I answer what it's asking you, and then just drop on your paper A, B, C, or D. Okay, how did we do? All right. Okay, habitual benzos use may result in physical and psychological dependence. So, they want the person to be as independent as possible. When I say independent as possible, without the medications. And so, but over time, or it depends on the situation, a person might cannot just not take any medicines. But we don't want them to the point where, they're taking it and they really don't need it. So we do want to encourage the person to seek out any coping mechanisms if possible. All right, so let's move on to depression and where'd it go? Okay, waiting on it to pull up. Okay, it's coming. This one I didn't put the colors and everything in, but the content, like I said, I just add those colors because sometimes it does, depends on what your learning style is. If you have that visual, it helps with remembering information. All right, so depression and other mood disorders. Let me share my screen here. We're gonna look at a little video. So again, we have these theories, the biological rhythms. So just make sure that you're just reading over that. But this is just why that these are just reasons that they've come up with how to look at a particular topic for us, depression and other mood disorders. They come up, and you may in your career come up with another theory too of how to look at it, and also what we should consider to how to take care of that person. These are just a list of theories. So do this, emotions throughout the life cycle. Do things happen in a person's childhood as they grow up that may impact, you know, their depression? Does it put a person at high risk for it or more susceptible to experiencing depression? Not only in their childhood, can we experience things as adults? And it could put us, in the situation where we might experience depression. So emotions in adolescence, depression in adolescence is usually related to four factors: self-esteem, loneliness, family strength, and parent and teen communications. And all those things, there are multiple parts of that. Loneliness Does not mean that the person doesn't have friends or is not around people, but it could be that the people that they're around, they may not be relatable. Person could be on the football team, play on the basketball team or the soccer team. They're part of a team, but still they may not feel that inner worth because their self-esteem might be not where it needs to be, so that they feel like they're productive individuals. They may not have that family support. Okay. Emotions in adulthood. Society expects adults to practice emotional control. So we do, it's kind of expected. Hey, even if you disagree with whatever's going on, is a way that you can remove yourself from the situation or how to respond without causing harm to someone or yourself. Okay. Emotions in an older adulthood. Depression is very common in older adults. Why do you think that depression is very common in older adults?
They start seeing everybody not need them as much as they used to.
They experience loss.
Death. Yeah, that's what I'm gonna say.
Exactly. So we work to look forward to retirement, but then once you retire, it's like, okay, well, what do I do? So then over time, it can domino out of control. Well, I'm not needed. I don't have anything to do. And so as a result of that, the person can start feeling down. Never mind, they have lived long and productive lives and they have taught people to be independent and to take care of themselves. So, but yes, you do see it in older adults. So again, we want to make sure that we're getting good health histories, that we are creating those, establishing those therapeutic relationships so that they will come forth and tell us how they really are feeling. And it doesn't mean that, the person is depressed now, they will always be depressed. If we can get that right balance of meds and coping mechanisms, and that person, can, live and be productive. So mood disorders, we have mania, emotions that are elevated, expansive, and even irritable. You will have that increased activity. And though sometimes they even have these grandiose thoughts that they are, something that they're not. They can, grandiose is an example of that would be you're talking to the patient and they're saying that they, have a spaceship and they fly to the moon whenever they get ready. Things that are like, just unrealistically not correct. So depression, feelings of sadness, disappointment, and despair. So we have different levels of depression. We have mild, short-lived. Like I said, that means that you will always be depressed. We can get, and it can be triggered. Someone, you all named it, life events. That person realizes, hey, I've retired now. I don't have anything to do. I'm not wanted. Someone can pass away that they, had a real bond with, and things like that. Moderate depression persists over time. That major depression, when depression is severe and it lasts longer than 2 weeks. 2 weeks. And symptoms can range from paralysis, meaning that person just can't even just get up to even brush your teeth, wash your face, take care of themselves. So we do have, okay, bipolar 1 and 2. I'm going to just take our time and read through these right here because you do need to know this information. Bipolar 1, episodes of depression alternate with episodes of mania. So we have a down and then we up. It alternates. Okay. More severe and incapacitating. That bipolar 1, the person, again, they can't do take care of their surroundings and themselves. Okay. They even may have hallucinations. Okay. Bipolar 2, major episodes of depression alternate with periods of hypomania, often marked by 1 to 2 weeks of severe lethargy. I mean, they just can't, just withdrawn. They just cannot just get up out of the bed and actually get moving. Okay. So we do have some more mood disorders. We have cyclothymic disorder, behavior of repeated mood swings alternating between hypomania and depressive symptoms. We have that seasonal affective disorder. You see that, when the seasons change. You see this a lot of times when you're going into the fall of the year. And even in some places that don't have, I think, what place is that don't have like the even or as even seasons, like fall, winter, spring, summer, that's what I'm talking about, that don't have those even, you would see this seasonal affective disorder in those areas. You see like a high rate of that because we do need that balance where it does changes. But for some reason, during the winter months, you do see this. And I don't know if it's because of the holidays, and that's when more people get together, and then the loved ones might not be there. Not really sure of that part. But they have associated with that daylight exposure, not being exposed to that daylight, that sun. So think about those places that don't have long summers, or even not even long summers, but that nice balance of those different seasons. So you would see a higher rate of the seasonal.
We recommend like a 10,000 lux light for like a light therapy for people like that. So
yes, so
maybe
they can
like
get that light. It's something about that light. Exactly. Now, what did you say that was again? You said 10,000 watts?
it's 10,000 lux, LUX,
Okay.
light therapy.
Got it. Good, good, good. Thank you for sharing. So there is a such thing as postpartum depression. And so don't take it lightly if that mom is saying, if they are, not feeling well or not able to cope and help take care of the baby. We don't want to make that like, because there is such thing as postpartum depression. And then we have substance induced mood disorder. So we're going to pause and just, I'm trying to make it stewards of our time so we can stay on track here and go over everything. Let me write a little time there. I'm going to adjust it here. Okay. So come back at 7:42 Eastern time. We'll take a 10-minute break, 7:42 Eastern time. So remember, this recording still plays, so turn your cameras off and make sure you're on mute. Let me get everything back sharing here. Excuse me. Should be able to see my screen. So, what behaviors are associated with postpartum depression? And you can just come off mute and share that.
Suicidal ideation.
Are there any others? So the question was, what behaviors or signs or symptoms would that person be experiencing if they have postpartum depression?
Maybe not want to take care of their baby or even connect with it.
Okay.
Yeah.
So when a person is taking antidepressants, what would be for the most part, we want that instant, yeah, the instant response. So what's that time frame that we're gonna, tell them? Because that's really important that people know,
For
hey,
4 weeks.
exactly. It's really important they know that this is not gonna be an instant. It's gonna take a little while. So that's the conversation, that reinforcement of education that we do want to provide for our patients. Because for the most part, they want, I need relief right now. So I'm taking this pill. I haven't seen any relief at the 2 week mark. Hey, just hang on in there. Continue your coping mechanisms. Continue your therapies. If the person has any, continue taking the medication because it takes a little while. It takes a little while. So lithium, we do see this medication given interaction between the lithium level in the blood and common table salt. So with knowing that there could be an interaction between the medication lithium and table salt, what nursing education or instructions information are we going to give that client if they're taking lithium?
Maybe educate them on a low sodium diet of some sort.
Okay, at least no added. Don't add the extra. Exactly. And so now we do want to encourage them to still, drink fluids as normal. But in the event that they are, just have that excessive thirst and drinking, more than likely they're gonna need to get their level strong to see, are they therapeutic or not. Okay. So nursing diagnosis and therapeutic interventions that are chosen based on the client's most distressing problem. We want to step back and look at the entire person. Are they, unkept? Are they not able to take care of themselves? Are they not, going to their job or whatever task that they have to complete? When they are around family and friends, are they unsociable? Look at that whole person and try to identify, some interventions that are coping mechanisms that they can implement so that they can, be productive and socialize and go to work or whatever their tasks are that they can complete. Okay. Let's see. Do we want to do another Kahoot or we want to? Yes, let's do the Kahoot to sum all of that up. Let me see here. Let me find it. All right, let me pull it up on the screen here. It's loading, so go ahead over to Kahoot It and get ready for the game pen. And you can like to just log in with your initials. You don't have to put your whole name in. Let me share here. Let me check the chat. I see a message in the chat. No, you don't have to wear your school uniform, but just make sure that what you have on is, not revealing, not your pajamas, you know. So if you already have your uniform on, that's fine. Okay, so go over to www.kahoot.it or use the app, and you want to insert these numbers here. Put the numbers in and at least log in with your initials. And so make sure that you're reading for understanding. Don't worry about the time, because Kahoot does, it does have like a little time thing in there. But just make sure that you're reading for understanding what the question is asking you to answer. Then read each answer choice. Don't forget about those words, like that one word that will make it, incorrect, like but, and, all. But just make sure you're reading. And I'm going to go on mute here so I won't interrupt you here. Okay, and let's get started. Okay, so I wasn't gonna say anything, but why is this kidney function blood test ran? Why is it so important when someone is taking lithium?
Because of that table salt situation.
That's also where the medicine is processed through the liver. The kidney, I'm sorry.
The weight, yeah, exactly. The waste products. So if the kidneys are not functioning like they're supposed to, exactly. So bring forth your med surge and all of that. You have to go back to it. Okay. Got it. Remember what we just said about the medications that they will, that's how some of them work. They dry things out. So this is one of those questions where it's like a priority question. It says the first choice. So when you look at these medications, we've talked about all of them, but it says the first choice. Good. You all are rocking with those. Let me pull up our next content. Let's see. Okay, so now let's transition to some more medications that are used for depressive and bipolar disorders. Let's look at some of those. We're going to talk about mood disorders and different types of depression. Trying to share here. Let's make sure we take our time and go through these. And there we go. So we do have types of depressive disorders. We have major depressive disorder, which is one or more episodes of depression. We have where it can also be chronic or ongoing. And then we have, and it breaks down to mild, moderate, and severe as well. So severe is where, remember we said that's where that person can no longer function, doing their daily tasks. Just think about what you do from day to day. You get up, you may fix breakfast or eat, or you may make your bed, may do laundry. Just think about all those things. So depression, those are person might have emotional symptoms that include feelings of sadness and no enjoyment of usual activities. Reading a book, watching TV, no matter what's on the TV, whatever the episode is, going out, sitting on the porch, those usual activities, that we are just, calm and collected with, a person may have no enjoyment whatsoever from that. And so when someone's depressed, like I said, it's like it kind of dominoes out of control. They might not be able to think correctly, and then therefore their responses are not appropriate. They may have the sleep disturbance. You do sometimes see that they sleep more than usual. We want to encourage enough sleep, but They find themselves just sleeping all the time. Then they may have it where they're actually feeling heart palpitations. All right, so let's look at this scenario here. We have a patient that is admitted to the psychiatric unit with a moderate depressive episode. The patient states, "Is this all in my head?" Which response by the nurse is most therapeutic? Again, the nurse might state all of these, but the question is asking which one of those are most therapeutic. Okay, let me give you a minute. Just put it in, just jot it down on your paper. Which one is most therapeutic? Okay, most therapeutic. Okay, so we are giving them facts, factual information, telling them what the disease process is, and then some treatment options. Okay, we don't want to give false hope, false reassurance. Okay, good. So acute mania, a person might experience, faster speech. Everything might more than likely is going to be heightened. Like they don't want to sleep, they should be sleeping. Turn a little timer off. They may have that irritability with the acute mania. Okay. So with the bipolar disorder, a person may have episodes of mania as well and depression separated by intervals without mood disturbances. So they may have these periods where everything is okay. But then those other moments, they may be manic or, on the, down on the other side. So then medications, we talked about the lithium. And people might even sometimes experience these grandiose delusions. Kind of mentioned it already as well. Adolescents and older adults most likely to have suicidal ideations. Adolescents, suicide is a third leading cause of death. Older adults, 1 in 2 attempts are successful. So these disorders are nothing to be taken lightly. Okay. So I'll read this question to you again. Don't try to pick your answer just yet. A patient being admitted to the psychiatric unit is very withdrawn and exhibiting signs of depression. He states, "I just can't believe how low I feel. Last week I was so happy. I was on top of the world. What's wrong with me?" Which disorder does a nurse suspect the patient is exhibiting signs of? Okay, go back and sift through, see what matches. Okay. On your paper, just jot A, B, C, or D. Okay, let's see how do we do. Okay. Was there a question? Okay, and give me just a moment here. So make sure you're on camera. Were you saying something, Miss Johnson?
Yeah, okay. So for that question, I thought it would be the mild depression. What would make it, what was it?
Let's go back to it. Let's go back to
Bipolar?
it. Let's go back to it.
I was going with mild too, not gonna lie.
Yeah, because but I thought bipolar meant like within a day it's changing. But I thought mild mean this week you can be okay, next week you'll be messed up.
Okay. What did you just say? Tell me what you said. Go back. It's changing. So we're talking about, we narrowed it down to bipolar and depression. I do hear you all saying that, right? Is that what you said,
Right.
Ms. Johnson? Okay.
Right, but I thought it would have been mild. So what would make it be bipolar instead of mild?
Okay, let's look at it from current slide.
Yeah.
Okay. So tell me, what's your definition of bipolar?
For me, what
Mood
I was
swings.
thinking was like, yeah, mood swings like throughout the day. 1 minute you okay, the next minute
Yeah.
like, ooh. But I thought for like mild depression, it would be like this week I'm having a good week. Next week, horrible week.
Yeah.
So we're talking about depression and bipolar. Tell me what bipolar is again.
Like
Mood.
yo, switch quickly.
Yeah.
Okay, so you have highs and lows, right? That's what you were
Right.
saying. So what is
Okay, I
depression?
get it. I
So,
get it.
so what's depression? Which one matches? Which one matches now?
You say I was
Okay.
happy last week. I was so
I think I
happy.
was confused on like the time it happens in, like the
Yeah.
yeah. I think that's what was confusing me about this question.
But think about with depression. Define what depression is. What's your understanding of depression? Does a person go back and forth, or is that person just on one side?
You stay on one side for most of the time.
Okay. Does the scenario match staying on one side, or does it?
No, because he switched from one
Yeah.
week and
Yeah.
then
Got it. Good, good, good. So go back to your foundation, what you know about those disorders. And then if it doesn't all the way match, it does, that's not the correct answer. Got it. Good, good, good. Great.
okay.
All right. So treatment of depressive and bipolar disorders requires we want to use non-pharmacologic agents if possible. But then sometimes we do have to use those medications. We have to do those medications. And then so know that, just provide those reminders. Hey, it's gonna take a while. It's gonna take a while for these medicines to get into your system and to create that, so for that you can get back to that more of a balance. Adhere to your meds, come in, get your blood drawn and things like that, so we can ensure that this is what's working best for you, making sure that that dose is working for them, because sometimes it's not the correct dose, especially when they get like toward that fourth, fifth week mark and they're not seeing any changes. It may not be the correct dose. Sometimes there's a combination of meds and all of that. But nevertheless, we do want to reinforce education about taking their meds, following back up with their doctor, getting those lab works and everything done. And then reporting whatever they're experiencing while they're taking those medicines, because we do know that there are adverse effects. And so we don't want them to be, experiencing something that it ends up being detrimental to them. So just tell them, hey, if you're experiencing whatever, keep a log or either call in and let your healthcare provider know. Because sometimes they do have to take them off, slowly take them off, titrate them, and or add in different medicines. So, true factors: patient history of response to previously prescribed antidepressants. They say, well, I've already taken something before and it didn't work. So, go ahead and ask, in such a way that's therapeutic to tell you more about what happened. Did you experience certain signs and symptoms, so that you can be more descriptive and have a better understanding of why they're saying, that they're not taking those medicines or those medicines didn't work for them. Okay. So again, getting as much information as you can from them. This is the same. Getting that history of that mood disorder, like, when were you diagnosed? What was going on? Getting that baseline mental status. Are they alert oriented times 1, 2, 3, 4? Getting as much information so we can see what their baseline is, so we can determine, if there's a change. Is this medicine therapeutic or is it not therapeutic? And for sure, we do want to ask, are, they, at risk or have thought about harming themselves? How are you sleeping? Do you take naps? This is part of our assessment as we're engaging with our clients. So, nursing considerations for mood disorder therapy. Of course, we're always providing individualized interventions. Doesn't matter if we have 5 patients that have a mood disorder. Each one of them specifically is still going to have their own individualized care plan. We want to think about their environment. If it's an inpatient facility, even if it's the hospital, is the area, the room that they're in, can they not share a room? How is the lighting? What about the sounds? We want to just check out the environment. It is at the part of the hall where that's the activity room. Like for example, if they're living in a assisted living facility or a long-term care facility or some type of in-house, is where the room located. Is it conducive for a person to get a good night's sleep? We want to consider all of that. And then, we usually don't see restraints much anymore. You still see them every now and then. You usually don't see restraints much. And then providing those nutritional needs. Who would we get to come in? Which person on the healthcare team to come in to be more specific and to do a deeper dive about this person's nutrition and their nutritional needs? Who are we going to invite in?
The dietitian.
The dietitian. Yes, don't forget about, we're the nurse and, everybody, we're like that center, but still we rely on pulling in those others. We want to, because that's what they specialize in. They can assist us in taking that deeper dive, especially if they're taking those medications where it's going to affect, their, not sure how that's happening, affect their nutrition, their kidneys functioning, and then their overall well-being. If they're losing weight or being, overweight, we do want to bring those dietitians in. So the AMOs, the MAOs, I'm saying, I don't know what I just said, but MAOIs. So they block the metabolic destruction of the norepinephrine, the dopamine, and the serotonin neurotransmitter. That's how it works. So they block those things from being destroyed. That's how they work. They literally put up a shield. And so use is most effective in atypical depression, panic disorder, and some phobias. So they block those from those neurotransmitters from being destroyed. So some more MAOISs, and we really don't see these as much. This Nardil, we kind of see it, but these others we don't. So, but just knowing the class, and so just knowing some nursing interventions. What are we going to be watching for? Looking at these adverse effects here. What are some things that we know that we need to just keep a watch on or check while we're doing our checks on our patient?
Blood pressure.
Exactly. Those vital signs, specifically that blood pressure. And if they're at home and they're getting discharged, what we want to tell the patient about moving around and everything?
Like get up slowly.
Exactly. Good. Okay. So before taking the medication, we're going to get that blood pressure and that pulse rate. So we're going to see what that baseline is. We do want to ensure the patient has not recently ingested meals with those high tyramine content, those aged cheeses and things like that. We do want to check for medications taken before initiating therapy. What are you currently on? What have you been currently prescribed also? And then tell me your story about these. Are you still taking them? And if you're not, can you share, why you're not taking those? So what about this glucose? What do we need to be monitoring that for? What could happen to a person that has diabetes and they're taking these medications?
Hypoglycemia, low blood sugar.
And so those foods that have that high tyramine content, it can lead to that person's blood pressure just being, extremely, extremely high. So we do want to break it down, and ensure that the person really understands, well, hey, I know that may be your favorite food, but do you understand why we're asking you not to ingest, these food items? We want to have that conversation with them, because a lot of times, people don't want to cause harm to themselves. It's just that they might not really understand why we're asking them, not to, add the extra salt or to eat the aged cheese and so forth. Okay, here we go. So we have a patient who has been taking an MAOI, states she feels dizzy when she stands up quickly. What is the best advice? On your paper, just do jot note. A, B, C, or D. And let's see, how did you do? Okay. What we just said, it can lower drop that blood pressure. So we want to encourage that orthostatic hypertension. Got it. Good. Okay. So the SSRIs, maybe we do see, I don't know if you all have administered any of these. Like I said, we see the Zoloft, the Celexa. They are widely used antidepressants. So with every medication, we have these adverse effects, you all. So we do want to making sure that the client tells us if they are experiencing anything that they normally wouldn't experience. We need to know if they are, a little timer, experiencing, increased agitation, nausea. Need to know about that. Medications might need to be changed up. Okay. And so the tricyclics, antidepressants, they may cause dysrhythmia. So if that person complaining of chest pain, shortness of breath, what might we think the doctor will probably order if they know that they're on these tricycle antidepressants?
EKG.
EKG, good. You're making the connections. Great, great, great. So of course, we're monitoring for toxicity. We're gonna draw those the blood work, get the blood work done, see what those labs are. Good. And then if a person is on warfarin or Coumadin, these medications enhances. So what are we going to be telling them about? I'm trying not to say the answer when they are shaving or things like
Be
that.
careful for no cuts and all of that because they're gonna bleed a lot more. Blood thinner.
Got it. Good, good, good. So great, making those connections. So here we go again. I'm not going to read this one to you. I'm going to let you read it and go. Okay, and let's see, how did you do? All right, we just said that. So just making sure what we just said, we brought it to a little scenario here. So while the patient they develop a DVT, they're needing that Coumadin. But we do know that the potential is there for this person, for that Coumadin to be in overdrive, to work extra. And so that person is at risk for increased bleeding. So we want to tell them we're going to safety always, but making sure that when they're shaving, can we use their electric razors, or making sure they don't bump themselves or get cut or anything, because they're going to have that excessive bleeding. Okay. Now these right here, we kind of see the effexor and the Cymbalta. You see that here or there. But the way that these work, they inhibit the reuptake and destruction of that serotonin. Again, they have that blocking effect. So make these words and things, make a connection with you. They block that destruction of that serotonin and that norepinephrine. Okay. And it says widely used. Like I said, I haven't really seen the Prestige or the Facema lately, the Cymbalta and the Effixor. We see those pretty common. Again, telling the patient to report whatever it is that they're experiencing, because we want to make sure that this medication is not causing them to be overly dizzy or drowsy or anything like that. And of course, like we mentioned early on, hey, take these medications, but you might not want to drive. See how they're going to affect you, because it may make you drowsy, and your responses might be even a little slower. Okay, so these TCAs are tricyclic antidepressants. I see amitriptyline. I see it for something else. I know it is antidepressant, but you see it, I think, for skin disorders as well now. You kind of see it more often for that, I think. Let me think.
You said nortriptyline?
Yes, I think, but that's why
Is it for nerve pain or something?
I think that may be what it is, nerve pain. And of course, medications, they were designed for one purpose, but now we're realizing, hey, we can give it for all these off-label uses. Yes, so we're seeing that. I think it is for nerve pain. What was that?
Like Cymbalta for pain and depression.
Exactly. I forgot about that. Yes, you're right. You're right. So you want to make sure as to why the patients, when you see these meds listed, why are they taking it? Because it's designed for one thing, but that patient might be taking it for something else. But you're correct. The Cymbalta is another one we see for that nerve pain. Good. Good. Okay. So drugs can cause, we talked about that orthostatic hypertension. We're going to encourage that client to get that blood pressure cuff, monitor it, drop in at the Walmart, the CVS. They have those monitors there. For sure, change those positions slowly. Don't know how it's going to affect you. So you do want to, may not drive right off. They want to have a driver. Want to see how if it's going to make you drowsy. You don't want to use anything, any tools or anything that you might end up hurting yourself. And then for the dry mouth, a lot of them experience that. Encourage them to do like the hard candy, the sugar-free, whatever, but nevertheless hard candy, or even just gum. Blurred vision may occur. So we want to tell them to be careful. Hey, because we don't want them out there driving or doing anything and they cannot see. But we do want them to report these things. Okay. And we'll set the timer. Select all that apply. Okay, here we go. All right. So why would we not see this prescribed for someone that has appendicitis? Has nothing to do with appendicitis, right? Not that type pain, right? Okay. So don't try to make it be, even though a person is a different type pain, not that type pain. The phantom limb pain, like we said, like the neuropathy, the pain that comes with the shingles and everything, that's a different type pain. Even the cancer pain is different from the appendicitis. Okay, so these are, now you kind of still see the Remeron being prescribed in the Wellbutrin. You do still see these. But nevertheless, we're encouraging that client to report those adverse effects, to take their medications. Hey, it's not going to be like take a pill, you're going to feel something instantly. Just continue to take it, continue to report what is going on with you. Okay. Common side effects of that nausea and vomiting. You don't see much of the abdominal cramps, but it can occur. But that nausea and vomiting is there. That excessive thirst. So just making sure that, what would we be concerned with if a client also had, I know we're talking about mood disorders, but we want to look at the whole patient. What's another disorder that we want to caution our patient if they have excessive thirst? You want to make sure that they don't get too many fluids on board. The person has what? Chronic disorder.
Heart disease, heart failure.
Heart failure, exactly. So look at the whole patient. So if they're experiencing this excessive thirst, we want them to be reporting, because we may have to change the medication, change the dose or something, because we don't want it to blow up into a domino effect where we cause the heart to fail even more, because they have all this excessive fluids on board, and the heart is not able to, it's not pumping correctly.
And excessive thirst can also be a symptom of diabetes as well.
Okay. Yes. And remember, we're monitoring that glucose with these medications as well, if that person is a diabetic. We talked about the food interactions with the cheese and everything. Okay. And so you notice, don't start reading the questions just yet. So we're doing taking tips along the way. I've read the question to you. So now I'm letting you read through and sift through and pause, because all that's part of understanding what the question is asking you. All right. And start. Okay, and okay. That lethargy that just, just can barely get through the day. Just really, really tired, sleepy, drowsy, and then being weak. Okay. Are there any questions there? Let's go on to this video I had pulled up. You all are doing really well with that. So just keep on looking at your content, bring over like your scenarios might have these other disease processes in there, like the congestive heart failure and things like that. So just make sure that you're bringing that information over and looking at the whole picture. Oh, I had our little video pulled up. Let me go back and log in again. It logged me out. Okay, it's pulling up. All right, let me share. And this is your osmosis video. We're gonna look at it. Just making sure it's checking the chat, responded to everything. Make sure you're on camera now. Not on camera. I need the reasons why you're not on camera.
I can't hear anything.
I can't hear nothing.
Ooh, y'all can't hear that. That little lady, she just talking away. I don't know why we can't hear it.
I
Okay.
can't hear her either, and I can't even get back on cameras. I've been on it for a while.
Okay, well, we'll switch gears and keep on moving. Let's go to our Kahoot. All right. So that's a video that you're assigned to look at anyway. So I was just gonna go ahead and just view it, and that way we could. But anywho, we'll move forward. Okay, let's look at this one. So this one, we're gonna look more back at the medications, and it's just 10 questions. So let me share my screen so you can put your pen in. All righty, put your pen in and let's rock and roll. I don't know, maybe my video inside was, going the wrong way. 8636042. At least log in with your initials at a minimum. Okay, we got everybody in. And let's rock and roll. Wow. Y'all rocking with this. Okay. Remember with this grandiose, grand, it's huge, it's things that are just not realistic. Like the example that I gave of the person going, they have their own spaceship and they just go to Mars every other day on Monday, Wednesday, and Friday, things like that. Okay. Which one does it matches? All of these things are mania is hyper. So all of these things matches the acute mania. Okay. Yeah. Last one. I think that's the last one. Psychomotor. Yes, it is. Okay. All right. So we do have. Let's just stop and take a 5 minute break, and then we'll leave our other. We still have our 10 minutes toward the end. So let's come back at 8:38. So what time is? Yeah, 8:38. We're just gonna do five, and then we still have 10, which you're gonna say those toward the end. See you in 5. All right, let's go ahead and finish it on up here. We're saving our other 10 minutes for the end. So let's go ahead and look at chapter 30, the concepts and stress and coping. Okay. Let me share my screen. And then we'll look at these few slides and then we'll do another Kahoot and that should take us on out. Okay. So is the person able to manage or not manage what's going on around them? I mean, things happen. There's a lot of stuff to manage, but is the person able to manage? Are they able to seek out resources? If even that resource is another person and say, hey, I need some help to identify. We do want to think about the whole person. So we want to consider the central nervous system, the endocrine. We don't want to consider age-related differences. Is this person a young adult or this is an elderly person? Stress, they're all different types of stressors and sources of that. We do want to consider that person's lived experiences. We don't want to make light of. Everything is important. So their lived experiences, their environment, whether or not they have other health conditions going on. We want to consider all of that. So as a result of stress, it can negatively impact our entire body, all of the body systems. Like I said, that blood pressure can be raised. That person can have an increase in GI symptoms. The stomach hurt all the time. With no root cause other than that stress, and that's real. So we do populations that are at risk: infants, children, adolescents, older adults. Individual risk factors, though. There are certain things, for example, food insecurity. If a person cannot get the food that they need to sustain life, whether or not if they're not able to pay for it or if it's not even available, a person can have the funds, but then the grocery store or there's not a fresh market. There's no way to even get the food items that they need. But all those things can domino out of control. Person, if they're diabetic, they're stressed out that they can't get the proper foods. They're trying to eat right, eat the balanced diet, fresh fruits and vegetables and things, but it's not available either because it's not there and or they can't afford to pay for it, because we do know sometimes that food can get expensive. So we do want to, when we're doing that assessment, getting all the information as possible, because we want to have that clear picture of what makes up this person. So that includes everything. We want to promote effective coping, health, and well-being, nutrition, exercise. We need a nice balance of all of these things. Okay, so secondary prevention, that's that screening. We're trying to detect whether or not there is something there. We're trying to detect or determine if there's a mood disorder, if the person is depressed. So what are those things that we use to screen? A lot of time there are different types of screening tools. There's no national recommendation. They do have, depends on what setting you're in. They do have like these questionnaires and surveys that people can take. Have you all rotated through the ER and when they triage them, they do ask everything from A to Z. I know some ERs are transitioning to let's take care of what the person's presenting with and then come back and ask all those other questions. But that's part of that triage. They usually ask those in-depth questions about, do you have, is it safe where you live? Do you have money to buy food? Has there been days that went and you haven't had food and things like that? They ask those questions. So coping strategies: problem focus, emotion focus, or meaning focus. It depends on, what the person has going on is what our focus would be. So some common positive coping strategies: providing that education, that information, just so that person can, make informed decisions and have a better understanding of what's going on. Because sometimes it's just the person just don't know. That social support. Identifying, are there some help groups? Is there a class that, the local health department is having? Is it something at the church? A lot of churches have, or these nonprofit organizations, they do have like these help groups and social supports throughout the week, at night, so people can still go to work and they can come and be a part of it after work hours. Exercise, are they getting in? Are they up and moving? They don't have to be, a sprinter, but are they getting that exercising? Are they going out, getting that daylight, absorbing the sun? Music therapy, that was another one. We talked about animal therapy, but they have music therapy as well. I saw this. A young lady had just had surgery, and the person, I actually have seen it twice here lately. Person had a guitar, and they came in the room and asked if they had any type of a preference, and they didn't, and they just played whatever songs that they wanted to play. The person that came in, and the other person, it was a different type instrument that they had, but we're seeing more of this now, where the animal therapy and the music therapy is being utilized. Just having alternatives to than just medication or something else in addition to the medication. Okay. So these are maladaptive. We know that overeating, denial, and avoidance of what's going on, those are not, conducive to the person getting more back to a balance. Okay. So medications that are being used, and we talked about all of these different agents. Okay. We want to consider the entire person. We got to think about what else could be going on with the person. If they have hypertension already, is this medication going to increase or decrease the blood pressure? We want to think about that. Okay. So what powerful tool would increase self-efficacy and control for a person who is stressed? So give you just a minute, just jot that down, 1, 2, 3, or 4. I'm gonna get my little timer up. Your time that went on. Okay. Will increase self-efficacy and control for a person who is stressed. So look for those keywords. It says increase self-efficacy. Okay. All right. Education, just gaining a better understanding or an understanding of what's really going on. Education regarding the situation and alternative coping measures is a powerful tool. A lot of it, most of the times, is a person just doesn't know or understand. So providing that clarity. Okay. Let me restart the timer. What factors may cause an individual to be at risk for negative outcomes from stress? So look for those keywords. Okay. And then, so why is it not a supportive family?
Because negative and support don't go together at all.
Exactly. So that's why I said, watch those words. Watch those words. It doesn't match it doesn't answer what it's asking. It says individual risk for negative outcomes. Got it. Got it. So just watch those words. Which of the following, do our timer. Which of the following is a body system that is associated with negative outcomes due to stress? Oh, I didn't hit the timer, you all. I think it's about 40 minutes, 40 seconds. Okay. All of them. Remember, we got to look at that whole person. Stress can affect everybody's system, everyone. Okay. Got another Kahoot for you. All righty. And So another test taking tip is, when you're reading through your questions, you may want to read them out loud. I don't know if they'll let you do it on the headset, but you're in that, for our exams, you're in the room by yourself. So, but anywho, if that works for you, sometimes hearing yourself read it out loud, it kind of helps you to pause and focus. Okay. So
So nobody can hear you when you're doing that?
No, not when we are, you're taking a test by yourself. But I said when you're taking a test, you're on campus, you probably can't do it then. But
Okay.
that's a test taking tip. While you're sitting there, I'm proctoring. I know no one's in the room with you, but if that helps, because sometimes that's why I read some questions and some questions I don't read, just so you can just see, if that's something that you might need. And the other thing with that, I know you all logging in, you can't use a paper. You can use dry erase board or, a Ziploc bag or that sheet protector. A lot of times people try to think that they have to use that for math, but you can use that for jotting. Of course, you're going to start with it blank. If you need to jot and focus and organize your thoughts about whatever it is, that's another test taking thing that you can use that dry erase board for, or like I said, a sheet protector.
You said we can't have paper for our HESI?
You can't use paper during your exams. I don't know what they let you do during HESI, but for
Are
your
there going to
exam,
be any math questions in our exam?
I don't know about mental health, but I'm just talking about overall, just so that you can, just think about more than just it's used for math. So
Okay.
we usually just let students bring a dry erase board and or the sheet protector or a Ziploc bag. They're all the same, as long as it's not paper. But my point is, you can use that for more than just math. You can use that because sometimes how you need to just jot some stuff down just to get yourself organized and just look at what you're thinking. So, all right, we got everybody in, and here we go. Remember, the entire statement has to match. So, okay. Are people staying up because they're stressed? So, when you reword the question, don't change what the question is saying, but you can reword, well, what is this question saying? Okay, people have stress and they're staying up. Okay. Test taking tip, just giving you some ideas. Wow, y'all answered that one quickly. Good. Classical music can have a physiologically relaxing effect through the reduction of heart rate and blood pressure. Yep. Remember the person that had just had surgery? I was telling you, they came in with the guitar, and still can't think of the other instrument that they had, but it's like, wow, it refocused that person's attention.
Somebody took my number one spot.
All right, it's not over yet. It isn't over yet. Keep it going. Okay. Yeah, Cahoots is based on your time too, not just um the correctness is a time factor in it as well. But I want you to make sure that you're reading and understanding and answering correctly. That you select the answer you mean to pick. Because once you hit that submit button on those exams, it's submitted. Okay. So let's see, what do we do? Life-threatening states such as trauma, acute myocardial infarction, which is a heart attack, or acute renal failure are known as. So no one picked emotional stress. Let's move this little bar out the way. Okay. So why is it physiological stress?
Because that's what's going on in the body.
What's going on in the body when someone has a heart attack?
It's not enough flow to the heart.
Okay, what's going on when the person has renal failure? Those kidneys are not working, so that's physiological. I break it down. Like, what is this talking about? A heart attack, renal failure. Which of these matches that? Great. Good, good, good. Okay, y'all rocking now. Two more, two more. This type of coping involves generating solutions to reduce or eliminate the identified stressor. Why is it not avoidance focused coping?
Because you're reducing or eliminating the identified stressor.
By doing what?
By problem focusing coping.
By
You're not
generating
ignoring it.
Go ahead.
Okay.
I was just you're not ignoring it. Avoidance is ignoring.
Exactly. So that avoidance doesn't match what they're saying. This person is, identifying a solution. They're not avoiding it. So they don't need that doesn't even match. So if it doesn't
Why don't
match,
avoiding something eliminate it?
got it. So we're attacking it head on. We're addressing it. Exactly. Okay. Got it. Got to watch my time here, y'all. Okay. This is two more. Two more. This type of coping emphasizes the regulation of emotional response, such as anger, fear, or anxiety in a situation. Which one does it match? Emotion, emotion, emotion. These are emotions, emotions. Got it. Some of them are just outright, it matches. It outright just matches. And they're not trick questions. Okay. I think that was our last one, right? Okay. How did you turn out? How did you turn out? Who was number one on this one? All righty, you all. We've come to the end of our time. We're saving our 10 minutes. Actually, I went over 2 minutes, owe you 2 minutes. So this recording will be downloaded and uploaded and of course shared in the shell. So we'll see you all on next week. Take care.
Hey, yeah, I'll see y'all later.
Bye, Professor.
Goodbye. Thank you.
Have a good one.
Professor.
Don't forget our 2 minutes.
What? Wait a minute.
Professor, please can I talk to you?
I know we want to be good stewards of people's time. We really do. We really do. That's why I kept looking at.
Professor, please can I talk to you?
Sure, sure.
Okay.
Okay, hold on. Let's just see
All
if
right.
anybody else is here that we need to stop the recording. If there's nothing that needs to be recorded.
Okay.
All right, let me Uh-oh, did you go away, India?
I'm here.
Okay. Emmy, the others that are here, are you all needing to speak with me as well? I can put us in the breakout room.
Yes, can you please put us in the breakout room, please?
Who was that just